Hi everyone. Welcome. Hi. Welcome to this session. How are all of you? Good evening. So nice to see all of you join into the session today. Hi, Dr. Chaitra.
Hi, Dr. Pallavi. How are you?
I'm well. How are you?
Very good, thank you.
We
Can you
lost
hear
you for
me?
a bit. Are you here?
I'm here.
Yeah.
Better?
We're losing you in between, Dr. Chaitra. We're
Is
losing
the
you for
signal
bits in between.
is the signal better now?
Yeah, it's better now.
Okay. Yeah, I'm just shifting between
Lovely.
internets because it's
Oh,
rainy
okay, okay.
season, and whenever it rains, for whatever reason, everything just goes for a toss.
Absolutely. And I think that disclaimer for the next 1 month of monsoon holds good for everybody, guys. If any of us gets disconnected, we'll log back in. But nevertheless, let's hope for the best. And today is, a very special day for all of us at Get Set Parent because we're doing a session that is a departure from the usual sessions that we do. So, Dr. Chaitra, as you know, our channel discusses, parenting styles, and mostly we end up talking about children. But today we thought, I think behind every happy child is a happy parent and a happy mom who feels good and who feels confident. So we thought, who better than inviting you here today for the session. So a very warm welcome to you to meet the Get Set Parent family.
Thank you so much. It's a pleasure to be here, Dr. Pallavi, and I'm so glad we're able to do this session. I'm so looking forward to this.
Super, super. So I'm going to start by introducing Dr. Chaitra because she is she's a really special person, and she's made so much time for us to come here today. So I do want to tell you a little bit about her. Dr. Chaitra is an internationally renowned cosmetic dermatologist, and she's the founder and CEO of the Cosmoderma Clinics. So, with over 20 years of experience, Dr. Fixit, as she's popularly called, is an alumnus of the prestigious St. John's Institute of Dermatology, King's College London. And she has a fellowship in cosmetic dermatology from the Miller School, University of Miami, USA. Dr. Chaitra, it's an absolute pleasure to have you here with us. And we're all ready to, pick your brains on what to do to all of us, working moms, harassed moms. How do we get to look better and what do we do about it? So,
Go for it.
so
I'm all
straight
set.
off, lovely. So straight off, I have to ask you this. How important is it to really take care of our skin during our 20s and 30s and maybe 40s? Is it something we need to do? Or, skin will take care of itself and we don't really need to bother? What's your view on that?
It's something that people always ask me about, and then they finally start paying heed to their skin in their 40s because, Indian skin tends to age well for most period of
Mm.
time. And you start seeing all the noticeable or visible signs of damage in your late 30s to early 40s. And that's when people start sitting up and saying, "Oh, okay, there's
Oh,
something
no.
I need to do." But, I always say skincare starts at 6 months of age. And you might look aghast at me saying, "What? At 6 months of age?" But it's true. Like, it's about protection. In your younger age group, it really is all about protecting your skin and staying protected and healthy. In the older age groups, it's about repairing and correction.
Yeah.
So this is how
Yeah.
we need to look up on skincare. And I always tell people, if there's only one thing that you're going to do in your skincare, just one thing, it's application of sunscreen. And this has to start start. So even for all the moms out there, you know, if your baby is 6 months and over, make sure you apply that sunscreen to the baby. And a common myth, you know, Dr. Pallavi, is that they think that, oh, if I apply sunscreen, they don't get enough sunlight, they won't get enough vitamin D. But it's just a
Yeah.
myth, because you don't need to have sunscreen on, like, you know, you make vitamin D by exposure to the sun, but it's just a little bit of exposure is enough. You don't need to bake in the sun, and sunscreen doesn't stop 100% sun from attacking your skin. It just creates a bit of a barrier. So in those ways, it's important to get started early and young. But in our teenage years, we don't need to worry too much. The skin is in a growth phase. Till we're 25, skin is in a
Yeah.
growth and a healthy phase. So it's taking care of itself in most times, right? If you just wear a sunscreen and you just protect it, you're kind of sorted. Unless somebody had thyroid issues or polycystic ovarian disorders or nutritional deficiencies, or, you know, they fell ill and stuff like that, then you need to take corrective course of action for it.
Okay.
Otherwise, till
Okay.
25, skin is very forgiving and takes care
Yeah.
of self. But after 25, you have to get into a skincare routine where you
Mm.
have some element of a cleansing, some element of a moisturizing, and definitely exfoliation with sun
Okay.
protection. These are the four
Yeah.
critical steps.
Lovely. No, but tell me now, I'm seeing that question coming up here, and that was on my mind as well. Now during the lockdown, we're all mostly at home. A lot of people are mostly at home. Kids are definitely at home. Do you need to wear sunscreen even while you're at home?
Yes, the reason is that it's
Oh,
not about being in the direct sun. Like if you see, I have light coming in through the windows. That's
yeah.
more than
Yeah.
enough to damage our skin. So the glass
Oh,
will filter out a portion of the light, but it's never gonna be fine if we don't use sunscreen. So sunscreen is against UVA and UVB. So one is the aging lines, the other one is the pigmentation. So it's about both of these. And so even if you're indoors and there's daylight coming into the house, you need to be wearing sunscreen. I tell people the only time you can get away without wearing it is if you live in a dungeon.
oh my God. Okay. So, I mean, I saw that on your feed as well, where you said if there's one thing you need to do, it is to wear sunscreen.
Yeah,
And I think
always.
that's, we neglect it so much. In fact, that brings me to the next question. All of us, we usually believe we are too busy to take care of our skin. And, we are either too busy or we're too lazy, or, we kind of, find some reason to not have a skincare routine. So do you have, top 3 tips that you would give people who are, not really focusing on skincare, but they should do to make sure that they don't damage their skin? Of course, sunscreen being one of them. Are there 2, 3 other things that everybody absolutely must do?
All right. So important things, there are a few steps. One is don't
Okay.
use a soap for your face. Use a soap on
Okay.
your body, but not on the face, because our skin has it has a pH value, which is acidic, right? That's the
Yeah.
baseline. And you don't want
Yeah.
to change this. And it only changes if you use, like, if you use alkali on acid, it neutralizes. And you don't want to do that because it makes it risque for the skin and takes down its barrier. So that's one thing
Okay.
to
Okay.
keep in mind. A pH balance cleanser or a soap-free cleanser is ideal. Second, sunscreen always. A SPF of
Yeah.
30 to 40 is ideal for a daily use. Look for a PA factor. We look for something called a PA plus 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 rating. So ensure that you have that kind of a rating in there. And then look for something that's non-greasy, non-comedogenic. And nowadays we even have sunscreens with built-in vitamin C. Like I formulated one for Indian moms, like you were saying, right? A quick step. And if you see
Yeah.
everywhere, we're talking about put a vitamin C, then put a sunscreen. And at the end of the day, with kids and home and work, we hardly have time to layer ourselves. So we made a sunscreen at SkinQ, which has a built-in vitamin C. So one layer and you're sorted for the day, kind of thing.
Okay.
So look for
Okay.
stuff that helps you to make it easy for you. In the night, always repair your skin barrier. So you were talking about using a moisturizer with like ceramides or
Yeah.
hyaluronic acid, because that nourishes your skin and restores its natural barrier. These are the critical steps that you need to keep on your mind on a daily basis. But along with this, it's important to think about skin exfoliation. Most people don't realize it, but the first step is sunscreen. The second most important skincare routine is exfoliation. So you
Every
must
day?
learn. No.
Every day?
Once,
No.
no. Never every
Yeah.
day. Only once
Yeah.
in 3 to 4 weeks. Not 2 times a
Okay.
week, not 3 times a week, but 3 or 4 weeks apart. So once a month
Okay.
is a great way to have it in your routine. You do what's called an active exfoliation once a month. Now, the other important thing to understand here, the other important principle is that it's also relevant to your age group. If you're under 25, your skin is forgiving. Once in 4 weeks is good. But once you're over 35, you need that exfoliation every 3 weeks, because your skin
Mhm.
starts getting sluggish, it starts getting duller, you start seeing patches, pigmentation, etc. So once in 3 weeks, if you're
Okay.
over 35, and if you're under 35, once in 4 weeks. So these
All
are the
right.
critical steps. It's simple.
Yeah. So my dear friends, like Dr. Chaitra said, sunscreen, moisturizing, and exfoliation. These seem to be the
That's
three
it.
things. And don't use soap on your face.
Yes, for
So,
sure.
yeah.
Soap is bad for face.
Yeah. So, Dr. Chaitra, we actually, we did an AMA on our handle. So, we asked parents to, put in their questions. And one of the questions which, I got repeatedly was about hair fall. And, so there was, of course, the postpartum hair fall for, new moms, but there was also, what do we do? Is it the weather? Is it stress? How can we prevent hair fall? Because that's becoming a pain point for many, many mothers out here.
That is so true, actually. Hair fall has just become like one of the most talked about issues, especially during this whole COVID time and COVID thing. And I think one of the reasons for that is stress, right? I mean, I don't
Okay.
think there's anybody who can say they were not stressed out during COVID
Yeah.
situation. Everybody has
Yeah.
had different stress levels and different ways of dealing with it. Now, it's important to understand what happens to our body when we are stressed out. When we're stressed out to our body takes all the nutrition and gives it to our brain, to our heart, to our liver and digestive organs, because these are critical. Your brain,
Yeah.
your heart, your liver, these are the critical organs. So it hoards all of the nutrients to these organs, and it kind of starves the skin and hair, which is why you
Hmm.
start seeing symptoms of stress first on your hair and skin. Now, when you
I
get
see.
hair fall post any kind of stress or even an illness, right? This is because that organ was starved. Now, typically what happens, this hair will grow back. It's a physiological phenomenon, which means it's normal for your body to react like this. It's called telogen effluvium in the medical terms, and it'll grow back. You don't have to stress too much about it, provided your nutrition is healthy, your hormones are fine, you don't have
Yeah.
any other disorders. But let's say you had thyroid issues, you had polycystic ovarian issues, or you had other issues, right? Then what
Yeah.
happens is that your body can't grow back the hair in the same density or thickness. The hair comes out lesser, it comes out thinner. So that's why it's very important to get onto a nutrition program. It's 4 months. A hair cycle is 4 months. You do a
Okay.
nutritional hair capsule for four
Okay.
months, and that will tide you over and get you great hair.
All right. All right. So essentially, we need to figure out ways to reduce stress and kind of keep it at bay, because that really affects hair health and hair fall as
Exactly.
much as we can. Yeah.
Yeah,
All
that
right.
is the COVID hair stress and hair fall that we're talking about. Then there is
Yeah.
other kinds of hair fall, right? Which is linked to hormones and hormone issues like hypothyroidism is a big cause. Polycystic
Right.
ovaries, which we see a lot of with
Yeah.
imbalances and cycle imbalances, that's also a lot. So you just have to keep in mind what could be the trigger and accordingly take action.
All right. Lovely. Another question which I got a lot was on post-pregnancy stretch marks and belly fat. Is there something that can be done about it, which is non-surgical? How can moms start feeling confident again about themselves? Is working out really the only way? Of course, I mean, we know it, that's the right thing to do. Are there other ways to get there faster?
Belly fat. So there's something called stubborn fat, right, Dr. Pallavi? Like
Yeah,
everybody has a body shape and everybody has a certain spot that just bothers them and irritates them. Like,
yeah,
let's say that you're slim all over, but you have
yeah,
only that belly area that always like the first place to gain weight, the last place to lose weight from. Then
yeah,
that's a spot fat. Some people have it like on their thighs, right? They just gain weight and expand in their thighs and hips and then it shrinks back. Some people get it on their bosom, their chest expands or
yeah,
their hands
yeah,
expand. So
yeah.
these are spot areas. When somebody has something like this, it's a stubborn fat, and you could starve yourself and then kill yourself with exercise and maybe it'll reduce. But because it's stubborn fat, one of the things you can do is look at stubborn fat reduction. We have something called cool sculpting, which is a permanent fat reduction, non-invasive. So think about it. If you're slim all over and there's only a pocket of fat, this is an option. But let's say overall, you're not that slim, you're on the slimmer side, but you're still kind of on the chunkier side, then those
Mm-hmm.
are not the options. Then it is exercise and calorie
Exercise and
deficits. Yeah, because
right.
it has to be a calorie deficit because if you do a deficit of 3,600 calories, that's when you lose 1 kilo of fat weight.
God, yeah.
3,600 calorie deficit. So think about it. On a normal day, if we eat about 15 to 1,800 calories and you work out and you burn 400 calories, right? You're talking about, 1 kilo of fat per month, literally. It's very
Yeah.
easy to gain it, hard to lose it. So it's very
Hard to lose.
important that, yeah, so very important that you have a balance between all of this. So that's about the belly fat, okay? The
Yeah.
second thing is stretch marks. Now, I do tell women that stretch marks is like, a scar from a war in some
Yes.
ways and stuff.
Yes.
And yes, it just means that your skin stretched beyond its capability and it cracked. That's what it is. The
Mm.
skin cracks and it leaves a stretch mark. And if you were seeing this in an earthquake, you would see as openings in earth, right? That's like an earthquake. So it's the same thing that's happened to your body. It has
True.
given way
True.
and stuff. Now, you can treat it when it's red. So if you get stretch marks, they're reddish or purplish in color, you may be pregnant at that time, you may be breastfeeding, but that is the time to treat those stretch marks. Because the moment they turn white, there's no treatment for it even now. It's better, like we can get maybe 30 to 40% results, but it's still never going to disappear on you. So,
Mm.
but if you have the
Mm.
red stretch marks, we can use laser, which is still safe in pregnancy, and use certain ointments and creams and clean up that stretch mark 100%. So you don't have to live with it. But if it turns white, you have to learn to live with it. Nothing you do is going to remove it. No cream, no oil, no laser, no peel. Nothing's going to remove white stretch mark on Indian skin.
So, but now those who already have the whites, what do they do?
Just say, hey,
Live
I
with
had a
it.
baby. I had a human come out of me.
Carry
This
it
is what
with pride.
happens.
Dear moms, yeah.
Exactly.
Stars of battle.
Yeah, one more thing. It's like this whole body thing, right? Body issues. Like in India, we're so hesitant about our body issues and we're so
Yeah.
like
Conscious?
unconfident. We're very
Yeah.
cautious and we're
Yeah.
unconfident in many
Yeah.
ways, right?
Yeah.
And we're
Yeah.
also ready to point out somebody else's faults and say, oh, look at that bulge, look at this stretch mark. And we're very unforgiving in many ways. And when you
Yeah.
live in the Western world and the Western culture, they don't care. They just flaunt it. Like even super hot girls here get scared to wear bikinis. And people with very average bodies are flaunting themselves in their bikinis because they don't
Yes.
concern themselves overtly on these things. So I
Yes.
think we need to just develop better
I think
self-image for ourselves.
culturally in India, I think one is used to, this quest for perfection, whether it's in our kids, whether it's in their marks, whether it is in ourselves, we don't want to go out there till we are 100% sorted and
Yes,
fixed, which is very hard. And
yes.
it's very hard on us, for us to, think
It's
about it that way.
true. My God, you're so right. And I think
Yeah.
maybe it's a cultural thing. We just want to be such perfectionists, right?
Yeah.
And we just think like, oh my God, we're at 99%. It's not enough. We're so hard on ourselves.
True, true. So I think it's time to, share that. And those of you in your 30s and 40s, if not now, then when? So it's time to,
Exactly.
then when?
Exactly. My mom
Yeah.
always says that to me. She says, if not now, when? Like,
If not now, when?
exactly.
Absolutely.
She always
So
says that
whatever
whenever I'm
you
lifting.
feel like doing to become confident, and even if you don't want to do anything, just go there and do something because you want to, and it's not about people. And I think, Dr. Chaitra, that narrative also flows into our children, right? How the children look, and this then goes on generationally. It becomes so cyclical because we then tell our kids, oh, you know what? You're a little heavy, don't wear shorts outside, or you're not, don't dress like this. And then,
Or you're gonna
you
get
know,
a tan, don't go out in the
you're gonna
sun.
get it. Yeah, correct, correct. So since when they are 6 and 7, it becomes deep rooted.
It's true.
So
You're so
yeah,
right. And it's
yeah,
it's also like very unconscious biases, right?
yeah,
And
yeah,
stuff. And I think I personally got more conscious of it after I became a parent. Like my son is 4.5 years old, and I became more conscious of what I say and what I do around him because I realized he just imbibes everything I say and do. And it's like input equal to output, literally.
yeah,
And
yeah.
so I was like, oh my goodness, we better be cautious about what we
No,
say.
absolutely. I mean, I have a 4.5-year-old and a 9-year-old, and I was talking about how I should, really get onto a diet and eat this and not eat that, and I saw the 9-year-old also start, saying, oh, this is too fattening, and I checked myself. This happened about 2 years ago. I said, I have to be very careful because you think, you're in a different frame of mind, and you say things, and these kids pick it up like that, you know and before you know it, it gets ingrained in their minds. So
Exactly.
coming to kids and you know um, preteens, teens, the whole skin journey. They're born with the baby skin, the beautiful skin, and then it starts going through adolescence and puberty. It starts going downhill. So, Dr. Chaitra, these days, what is the norm? When should we as parents expect acne in kids? At what age does it start? Whether it's girls or boys, what age should we start expecting it? And has it changed from the years we were growing up?
Yeah, for sure. It's a great question,
Yeah,
It's changing. Like, when we all got our periods, we were like 13 to 15 was kind
yeah,
of the norm. And
yeah.
today, 9 to 12 is the norm. It's totally
Hmm.
changed. And one of the
Yes.
reasons for that is the environmental changes, right? It's
Yeah,
not like
yeah,
we're exposing ourselves to pollutants purposefully, but what happens is that, you know, food we eat, like the soil, there's pollution in
yeah.
soil,
Yeah.
water, like the groundwater has plasticine in it, and
Yes.
the
Microplastics
cows.
are everywhere. Yeah,
Exactly.
yeah,
And the cows,
yeah.
which used to give 20 liters of milk, today give 50 liters of milk. How did that happen? Because they got pumped with hormones. The chicken, which
Hormones.
was like half a kilo, now you get one chicken for 1 kilo. Your egg
Hmm.
size, which was so tiny, became so big. How did that
Yeah.
all happen? Genetically modified food, milk, everything. Even the vegetables are larger in size. They're nicer colors. Like, your tomatoes nice and red
True.
and pulp, as opposed to
Yeah.
like your desi tomato, which is like, kind of thing
Yeah.
and stuff.
Yeah.
So that's what it is. We're imbibing
That's the
hormones
price
and
kids are
chemicals
paying.
in our food.
Hmm.
And which is
Hmm.
why puberty is now at an earlier age. Now, the baby skin will stay as long as the hormones don't interfere. The moment hormones start
Okay.
interfering, they're going to start seeing all of this acne. Like we do see, it's not often, but we do see people, kids with 8-year-old kids with acne. And, there's only
Oh.
so much we can treat them. We can't treat them too much. We can treat them so much, but we do. So these are few important things that one must know. But what I would like to say is, doesn't matter whatever the age of the kid is or the adult, for the mothers also, acne is not normal. It's not what we say is physiological. Acne is a
Oh.
disease. As skin doctors, we treat acne as disease. It could be bacterial in origin, it could be hormonal changes, it could just be one of those growing out phases. But if you have acne or your child has acne, get it treated right away with your dermatologist. because the scarring of acne is worse. It's very
Yeah.
easy to actually treat and control acne, but it's really hard to clean up the scars. And the best way to prevent scars is to treat acne right away and nip it in the bud. This is not something you go to your salon and tell your therapist or a beauty salon thing, oh, let's
Get
do
a
a
facial
cleanup, a
done. Yeah.
pimple, open it up, let me pop it, and all of that. This is where you
Yeah.
actually go and get a proper treatment done at a dermatology office and get it sorted. Once it's sorted, it's totally fine. You're totally sorted. So it doesn't matter if your kid is 8 and is getting acne or your kid is 17. It's not normal to have acne. Okay. Yes, teenage kids do get acne because of the changes in the oil balance of the skin, changes in the testosterone level, but that doesn't mean it's normal. So deal with it. You don't always have to take oral medicines, even just regular topical creams can help that, but get it
Yeah.
treated. So this is what I want to say
Yeah.
about acne for sure to everybody.
So even if kids, are 10 and 11, we don't treat it as something that they will outgrow at 18 or
Yeah,
19. We address the issue, right? You
exactly.
don't
Just
wait
take
for
them to
it
your
to
doctor.
disappear. You need
Yeah,
to visit the doctor like you would for any other disease or any other
exactly.
ailment. Yeah.
Exactly. You don't need to do
That's
a
a
chemical
beautiful point.
peel.
I think, during our years of growing up, it was something that teens had and they grew out of it 20. But, this is a revelation when you tell me that irrespective of what age, they can, you can actually get it treated and corrected early on.
Mm-hmm. Exactly.
Yeah.
And the thing is, you don't need to have like a peel or a laser all the time. You can just get creams and take care
Yeah.
of it so that it doesn't become worse. And with kids, what we say is that it's a space, right? It's going to keep going up and down, up and down. So the whole idea is to keep it balanced and to make sure that you don't get worse with it. That's all. So that's all it is.
Yeah. So during these years, the preteen years, so what do you suggest they use? Do they use like, over the counter, your neem face washes, and are those good enough for kids to use?
Yeah, yeah, there is no harm. Like if the kids are getting acne and stuff, you can look for like neem-based washes, right? Face
Yeah.
washes, those
Yeah.
are good. Tea tree based cleansers are good and
Yeah.
stuff
Tea
like
tree.
that.
Yeah.
But don't use any other harsh chemicals without taking recommendations from the doctor. That's very important because you don't want to damage young skin. There are like
Right.
various different medications we give. We give retinoids, we give like salicylic acid, beta hydroxys, alpha hydroxy acids. We give antibiotics, all topically, depending on the skin type and the acne type. There are 4 to 6 types of acne. So it depends on what we're
All
looking at
right.
also. So it's very important
Okay.
to just get it treated properly. But yeah, at home, you can definitely use neem-based face washes. You can use tea tree-based face washes, green tea. And if the kids are in their teenage years with oily skin, you can even get away with using salicylic acid face washes.
All right. In fact, it brings me to my next question. But before that, dear parents, if you have questions, now is the
There's
time. Please
tons
put
of
it.
them. There's
I know.
tons of them. So one of the
I can.
common ones I think we got
Yeah.
asked was sunscreen for kids and infants. So,
Yeah.
you
Please.
know,
Yeah.
yeah, so sunscreen, all sunscreens are honestly the same. There are 2 types. You
Okay.
have a chemical sunscreen and you have a physical sunscreen. Chemical sunscreen is usually gel-based, tends to go on, non-greasy, non-toxic, and doesn't clog your pores and stuff. The chemical sunscreens are more of a barrier, and you can use these on kids also safely, but it does leave a little bit of a grayish hue stain. It has zinc
Mm.
oxide, titanium oxide.
Yeah.
But the
Yeah.
brands that I usually recommend for kids in my practice, I ask them to use Cetaphil sunscreens. I ask them to use Aveeno sunscreen. I also ask them to use Bioderma sunscreen and Neutrogena. These are my go-to brands for kids because they're safe, they're
So all the way
efficacious,
till
and
12
test
or 13, they can use
all the
these.
way, and even adults can use this. There's no
Okay.
harm, right? But yeah, so this is the one thing for kids. It's totally safe to use these sunscreens. Now, if you're
Yeah.
in your teenagers, 16 and above, or you're an adult, then you can use all the other sunscreens in the market. Few things to note: SPF 30 or 40 as should be your minimum sunscreen. It has to have a PA rating of at least 4 and above. So it'll be plus, 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 plus
Plus,
and
plus. Yeah.
above. That's what it is. You look for something that says non-comedogenic on it because you don't want it to clog your pores. And there are so many various brands that you can use. And then just ensure that these are properly manufactured. Like, you really want to go with a medical brand. You don't want to do a beauty sunscreen unless it's been tested. You don't know if the
Yeah.
SPF rating is right or not. So this is something you have to keep in mind.
Yeah, in fact, that was my question, that there is such a multitude of products. First of all, there are the mass packaged, products over the counter, your medical shop and your supermarkets. But today on Instagram and Facebook, there are so many, products which have sprung up. You don't know who is making them, and there's such a multitude of products, all of them claiming that. So how does a non-doctor, how does a a lay person kind of navigate this entire skincare, product market?
One thing to remember, cheapest is not always the best. It's important to
Mhm.
look at affordable skincare, but remember
Yeah,
this, it's the same with anything. If there's something of quality on it, it doesn't mean that it's going to be super cheap. So if you see something which says $1,000 but only it's 499, please understand something is off. Let's be honest
yeah,
about it, and let's
yeah,
use our brains when we shop at the end of the day.
right.
And there's good things in everybody's budget range, right? You don't have to go and get like a 2000 rupee sunscreen, but a good sunscreen typically will cost you between 800 to 1500 rupees if it's got the right kind of filters in it. Otherwise, the sunscreen can't be very sasta or cheap because the filters are expensive. So that's one
Hmm.
thing you must understand. And look for reputed brands. There are brands that have built reputation over the years, that have clinical studies, clinical data. It's all there on the internet. So look up all of these things and you'll get an idea as to what you need to use for yourself.
Lovely, lovely. So I am seeing questions here about, okay, anything interesting catching your eye, Dr.
So
Chaitra, that you would
people
like
are
to?
asking me for kids shampoo and moisturizers
Yes,
and under the
yes.
age of 10 and 11. So my suggestion is, I prefer pharmaceutical brands rather than OTC brands when it's kid skin, because of the data and everything. So I always recommend like Aveeno, and I recommend
Sebamed.
Cetaphil, Sebamed. These
Yeah.
are the go-to brands that you want to use safely for your kid. I even like Johnson's Baby shampoos and moisturizers. They have been formulated really well and they're reasonably priced for the kids. Nivea has a baby range that's also effective as a moisturizer for kids. So this is what I look at, right? All of this data when I'm looking for kids. And with kids skin, just remember one thing, their skin barrier is still developing. So you don't want to use anything too harsh on them. You want to safeguard their skin. And one thing I would always suggest is, one point to note, oil massages are really good. At least once a week, you give your kid a oil massage, like coconut oil, olive oil, whatever you have,
For
it's
skin and
fine.
for hair?
Yes, for skin and for
Mm.
hair.
Mm.
Definitely massage it in, and then you don't need to leave it on like for a long time. 20 minutes is all it's needed. In 20 minutes, the skin will absorb whatever it needs, and then you can just go for it. That's what you need
Okay.
to do.
And
And
what about Himalaya? There's a question about Himalaya. You didn't mention
yes,
that. Is that good for you?
Himalaya is a good brand. It is a good brand with a lot of data and research. You can trust Himalayan brand. They definitely are lots of studies on it.
Lovely. And a question about pigmentation and, I mean, I think you covered it in sunscreens, I guess?
So
Or,
pigmentation, yeah, there are many things to understand with pigmentation. There are various causes for pigmentation. A pigmentation is never just a patch of pigment. The pigment could be brown, it could be gray, it could be purple, it could be bluish, it could be reddish. So there's so many causes, but one of the commonest causes we see is sun damage, which is caused photomelanosis, and the other one is melasma, which is pigmentation on the cheek and nose and stuff. And then the other one is around the mouth, perioral, which is
Mhm.
related to the hormones. So with these things, sunscreen is definitely a mainstay. The second option is to use like pigment lightening agents like kojic acid, and emblica, licorice extracts, glycolic acid, and that was one of the reasons, like another question here was like, oh, things are so expensive. What do we do kind of thing. So that was one of the reasons I actually came out with a skincare line a few months ago called Skin Q, which is about skin quotient. It's skincare line for Indian skin, for people with pigmentation, where they get the pigmentation kit. They use it at home. It's almost like doing a chemical peel at home for yourself, but it's not super strong like a clinic one, but efficacious one that you treat yourself. So that's your exfoliation program. It also
Okay.
has the glow or the detan pigment lightening agent. So you use that as a serum, and then you have a sunscreen. See, it's very simple, right, Dr. Pallavi? You need to use a right cleanser, a sunscreen, a lightening agent, and an exfoliant. 4 things is all you need in your skincare, and maybe a 5th, which is your barrier repair. You don't need 20 serums. You don't need a 10-step care. In the morning, you put a serum and a sunscreen. In the night, you put a serum and a moisture barrier. That's it. Right? And then exfoliate yourself every 2 to 3 weeks. You're sorted. It's really simple. It's just making sure you get active ingredients in your skincare. You know, I'll tell you something.
So would you recommend night creams?
See, you need a night cream in terms of a moisturizer.
Night cream that is called,
Yeah, you need it if as a moisturizer, especially post 25 to 35 more so. If you have oily skin, you don't need a moisturizer a lot of times. You just need a hydrator. Okay, moisture is oil, hydration is water. So you need both these elements. But post 35, you get drier, then you need a moisturizer to repair your skin barrier. So that's the ceramide and hyaluronic acid, because it's got moisture and water, and you're sorted. Now, anti-aging. Now, let's say that you start getting a lot of people asked about like anti-aging crow's lines and stuff. So if they're getting that, then you need to add retinol into your skincare. So in the night, you use a retinol cream and you use a moisturizer. So that becomes.
So what would be a good retinol cream?
Retinol creams, you need to look at retinols that have 0.5% and above. Anything less than 0.5% is not efficacious. Olay has good retinol compounds. Sorry. Olay has good Olay has a good retinol cream, which is very affordable ratio. In SkinQ, our oil and acne control elixir has retinol in it. You know, so there are a lot of creams that are available. Just make sure that the retinol is 0.5 and above.
All right. Lovely. So let's take the last 3 questions. Your pick, Dr. Chaitra. What do you think you would like to address?
Okay. Sensitive skin moisturizer. Okay, Priyanka, when you have sensitive skin, it's your skin saying it's damaged, that something's not right about it. So you're going to have to balance and repair your skin barrier. Now, your skin barrier is made of oil and water. It's a combination of 2 different things. And so you need to give moisture and hydration. So look for a moisturizer which has ceramides, which are nothing but lipids or fat molecules, which will seal your skin, which has hyaluronic acid and sodium hyaluronate and vitamin E. This would be a really good moisturizer for you to use. You can try the SkinQ Moisture Balm, but there are other ceramide moisturizers in the market. You can look it up. Another question, exfoliating cream. There's nothing like an exfoliating cream. Exfoliating solutions usually, they're in gel forms. Active exfoliants are always in gel form. So use that. Please don't use microbeads or, you know, seeds and stuff. I know apricot extracts were like a huge thing for a long time, but they're great for the body, not for the skin on the face, because the skin on the face and neck is much more sensitive and you can get hyperpigmented easily. All right, let's see. Last question. What shall we do? Lactocalamine lotion. That's a good question. Lactocalamine lotion is nice. It can also act like a sunscreen for sensitive skins because it blocks physically. It's good for healing of the skin. It's a cooling, calming lactocalamine lotion, but it's not moisturizing. It just acts like a sealant, but it's not a moisturizer. So I think, oh gosh, so many questions, Dr. Pallavi.
So many questions, but yes.
All right.
I think,
guys you can DM me and we'll answer it. My team and I will answer it for you.
You can follow Dr. Chaitra. She puts up a lot of interesting content, you know, which is seasonal, which is to do with, you know, the current situation. And those of you who can visit her Cosmoderma clinics as well, and I'm sure you will get brilliant consultation. And Dr. Chaitra, yes, I'm going to come when I'm in Bangalore next to meet you. But thank you so much. I mean, you know, I think a lot of these things one has heard about, but we always need these reminders to say it is important and we really should take care of our skin, because suddenly you're, you know, 50 and you're like, oh my God, you know, now I don't want to do something too drastic. So I think like we talk about even in parenting, you catch the kids young, get the good habits right, and then you're taken care of. Similarly, I think, you know, with skincare as well, you fix it early on and you age gracefully, I guess.
Very true. That's the word. You age gracefully. And look, I mean, we work so hard at staying fit. You know, we work out
Yeah.
and a little bit of weight we gain, we're dieting. And then, you know, you see a split end, you go and cut your hair. You see a gray hair, you go and dye it. So when your skin is sensitive or your skin has lines or acne or pigmentation, it's a cry for help. So why ignore it?
Absolutely. But thank you, Dr. Chaitra, for, infusing us with some new energy to go and look for the right products, take care of ourselves, and, take that much needed pause in, our work lives and parenting. It doesn't take too much effort, 10, 15 minutes to take care of ourselves, and we owe it to ourselves, I guess. Yeah,
Thank you so much for inviting me. And I look forward to seeing you shortly. Take care, Dr. Pallavi. Bye.
absolutely. Thank you, Dr. Chaitra. See
Bye.
you guys. See you, everyone. Bye.